the ICC for giving me this opportunity to come here and speak to all of you. It's very important to talk to you. I especially thanks Dr. Kamal, Dr. Mustafa, and also my chairpersons here, Prof. Ikram and Prof. Shariful Islam. Thanks to Tasneem for moderating this session. So I just want to briefly introduce myself because that's relevant to my talk. So actually, a little bit of my life cycle that I born in Dhaka and raised in Karachi, two different country now. And then from there I moved to Ireland, lived for a while, become an Irish, though I don't look like an Irish, but I become an Irish. And then from there I moved to Canada. After working a long while in Canada, I moved back to close to my home, and I'm now in Middle East. So with all this going around, I have seen many things which actually bring me to present this, what I'm presenting today. So I'm going to present this, our society, AMSTRO, and I'm proud that there are members of AMSTRO present here. So you heard Prof. Goodman that there are many challenges in our region, and those are not just one or two, there are many. I listed some in here, but they are not limited to these challenges. So I listed technology gap. There are big differences in the region. From Dr. Jamal Khadar, who is from Jordan, he's here. In his center, he have MR Linac. But there are centers where people are struggling for only cobalt machine. They don't have that sophistication. Then there are a huge workforce shortages. So where I am working, we have shortage of patients. We don't have shortage of machine. We don't have shortage of staff. And literally we can treat double the number than what we are treating now. But there are centers where Dr. Nadeem Pervez came from. Their machine work from morning till night, midnight, and they do the shift because they don't have resources. And there are difficulties in training. If you look into, we extrapolate the guidelines come from the West. Did we create our own guideline? Did we do our own study? Our answer is no. We are following everything coming from the West. We are in the taking end. We are not on the giving end. So there is a big issue there because the type of patient I see there and the stages of the disease is different in our region than in the West. And we can actually contribute to West. We can actually give them something which they don't have much of experience. However, that's shortage. And because of that, because of variability in our region, that we give suboptimal treatment to our patient in a lot of places. You know, it's an unfortunate situation, but this is the truth. So with these challenges, what we think as an individual physician, I was working in my center, taking care of patients come under my hand and work hard really to do as much as I can do. But is that enough? I asked this question to myself and I asked the people in the audience, is this enough that the patient in your hand, you give good care and we have no other responsibility to anyone else? In a sense, yes, but on the other hand, we do feel responsibility because there are lots of shortage. If there is a factory and you have only few workers, those workers have to work hard and work more. So we are in that situation. We may have to save ourselves from burnout, but we need to do as much as we can do. So in my opinion, a society can deliver way better than an individual. So therefore, this Asia and Middle East Society of Therapeutic Radiation and Oncology, our colleagues in the region come up with, and they're thinking that let's use this society to enhance and improve the patient care in our region. So these are our mission and vision, not much different from many other organizations. However, these are the words, but actually we want to deliver. That's the difference for AMSTRO, that AMSTRO just don't want to talk. We want to deliver to our region and we want to prove it with time that how we deliver it. So these are our mission and vision. I can read or you can read it sometime on the website either. And after mission and vision, we make some of our goals. With every goal, we have some sub-goals. I would say that our challenges are almost unlimited. So as I would say, our goals are unlimited. However, we summarize some of the targets we want to achieve into few goals, and every goal have some sub goals. I don't want to take your time to read out all this to you, but we want to unify the region. We want to do networking, collaboration, innovation, advocacy. You heard Prof. Avery that how they are promoting the physics program around the globe. So we want to bring that to our region as well. We want to have those kind of collaborations and help each other. So then in our goal 2, we want to strengthen oncology education and workforce capacity. If I truly talk to you, there is workforce. There are some very good doctors working hard, but there are other workforce who can receive a little bit more training and can enhance their skills, and that we can work together. We can do that. We can always work as for when it comes to education. I always think about C4 platform, which Global Health Catalyst is bringing. If we can do modular-based training to our worker currently to enhance their skill, and actually that would directly benefit the patient. What we are looking into, we don't want to take too long. There are challenges now and there are challenges later. We will have our long-term program, but what we want to do is a short-term, quick solution now. Now what's happening to every patient every day. So C4 can help us in those, and I was talking to the Global Health Catalyst group that we need that through AMSTRO. Then we need to foster innovation. As we talk about, there are lots of things we can do together. We can do research, we can do education, and that can happen only collaboration. Without collaboration, we cannot do that. There are concepts individually in our mind. It die off. It never take off, never kick off, because some people don't have the concepts or ideas. The other people don't have number of patients or means to do it. So in our region, we have everything. We can do it, but we have to come together. Some countries, there is this region which I'm representing today or talking about, has a huge disparity. There are big difference. Some people have money, machines, skills, other people have none, and some people have patients, number of patients. There's one of the example I can give very proudly that Dr. Nadeem Pervez is here. One of his mentee, Dr. Fatma Shaukat, and me discuss a concept about a breast cancer study. And we submitted for a grant which was an international competition. And she won the top grant for those. And I told her, I have the concept, I cannot run it, I don't have number of patients. And she said, I have number of patients, but I don't have funds. So by coming together, this is an example. Coming together, I was a couple of weeks back, I was in Karachi for inauguration or initiation of that program. So we have those strength, but we need to come together. That's what I really want to give this message for. So anyway, so we have to set up our clinical trial unit, we have to do our research coordination, collaboration, funding, whatever. And then if you look at, we have, I don't know whether right thing to say or not, but I was in Pakistan, I studied in Pakistan. I see my professor, they were very strong, personality-wise and knowledge-wise. And then there is a big gap. And when one professor retire or leave, there is no leadership afterward coming. And then, if I wouldn't move to West, I may not be able to talk to you standing here and talking to you. So are we transiting the leadership? Yes, we are. I'm not saying that it's at zero level. It is going on, but is it enough? I think not. I'm just thinking that I want to give this, my flag or my light to someone who take after me. Who is that person? And if I don't plan it today, you think 5 years later someone can take place what we have in our AMSTRO? We have role, but who is going to take those roles later? Do we have someone in mind? Are we mentoring someone or preparing? Really good example, Prof. Avery mentioned Prof. Saiful Haq, that how much work he did, I heard. Prof. Nadeem Pervez is sitting here, I know he's very humble, but he changed the landscape of radiotherapy in Pakistan. I call him Nadeem Abbasi University. Share the same name, so I don't call when someone asks me, I said, you're talking about Nadeem Abbasi University, not a person. He changed the landscape. I just talked to you about Fatma example, and Fatma is his mentee. And it's not only one, there are many. So But he have to overwork because there's only one person trying to work. That's not enough. So we all have to think in this room sitting here, what we are going to leave the legacy behind us or after us. So one, so one of the goal of AMSTRO is to create the leaders who can lead future in our place. Just put yourself, your place, and say, who is going to lead after me? But we need to prepare. It's not going to come in 1 day or 2 days. We need to work on this leadership. And, I would bring this that, I'm standing here in Bangladesh, my country of the birth, and you always have attachment. Wherever you live, where you're born, you feel happy. My children were this morning telling me that, Baba, I heard you're going to go Bangladesh. They may keep you. I said, yes, because I'm from there. So they are worried that, they may keep me here, Bangladesh, because I'm born here. I said, yes, so I have that attachment. So everybody have their attachment. So I'm talking now in the short term for the Bangladesh. What we can do for Bangladesh. We can do many things. We can do. There are people who are doing a lot of work in here. But we can work together. We can do it more strongly. We can build any knowledge gap. If we have some knowledge somewhere and the other place not, we can come together and build that. We can do targeted workshop. We just did one workshop a couple of days before. It was not, we should have been more propagated, but I want to have that relationship with Oncology Club, BICC team, that if one education event is happening, it should go to our whole region. Everybody should benefit. In this era of virtual workshops, in this era of virtual seminar, the knowledge is not limited. It can flow anywhere in the world. Prof. Saiful want to bring everything to the cloud. We may need to take a flight to go to the cloud, do something. I'm just joking. That cloud is only to work everything on the ground. So in this time, when we're talking about cloud, we're talking about C4, we're talking about global health catalyst. So we should do the same thing for education. Just disseminate. We can do fellowship observership program. Already talking to Dr. Kamal about that. We really can do that. We do mentorship, we can do fellowship, we can do short grant, and just learn one skill and bring back to your home, not come back empty. And we have digital learning platform like C4. I told you I'm really highly interested that how we can use it for our whole region. And that can actually bring things to Bangladesh. Bangladesh should not be follower, should be leader. And we need to talk about that very seriously, that who is going to come forward and want to be leader. So this is one of the area which we are quite deficient. Someone will talk to me and say, we are not treating patient properly yet. The clinical gaps are there, and you're talking about research, because we all think research is next level after we did the clinical practice well, or we deliver no. Answer is no, because research and clinical treatment go side by side. If I was part of any protocol, any published big study which changed the practice in the world, if you participate in that, you learn 100%. If you read an article, you learn 10% only. I just give you one simple example because there are many radiation oncologists here. Yesterday I was busy in Riyadh in a breast contouring workshop, and one of my residents, when I presented, finished, then she said to me, you did not say about the RADCOM atlas, which part of the contouring, but because by only reading, you would not learn to explain her that RADCOM was developed for the proton-based treatment. We don't have any attendees here which from proton-based. So if you're not involved in something, if you're involved in something, your take on that thing is humongous. And if you ask me anything in my so many years of experience, radiation oncology, give me the highest learning. Number one, our patient. Number one. Because they bring the necessity and then we do something for it. And number two, I would say the research. So these are very, very important. And then the third thing I would say, peer review. Dr. Abbasi is sound as a crazy person in Pakistan talking about MDT. The people give him name as Nadeem MDT, and then peer review. So without peer review, if I wouldn't have attended in Ireland those peer reviews, I wouldn't be able to cope in Canada or in Ireland to work at that level. So the peer review is another. So I'm just summarizing it. I'm not saying these are the only, but these are the main. So we have to have clinical trial unit. We have to have, and we have to be part of research while we are developing our skill, while we are providing the patient care. At the same time, we need to build our research capability, which will help us to practice better. We will know our limitation, how little knowledge we have. It's like a drop from an ocean. That's the knowledge we have today, what we are practicing. There is an ocean of knowledge. That can only come from research. So now, also, we need to then disseminate we have a problem of direct application of Western guideline. I already mentioned to you that we need to get together. Here, I feel that I'm going to talk during this meeting to our leaders in Bangladesh, that how we come up together and create our own guidelines, which actually required for us. Last week, I was in Vienna, and they were talking about CT-based auto-contouring of prostate gland. It is so relevant that another week before, I was in Pakistan, I was talking about prostate contouring, and I saw major pitfalls in there. And when the resident sitting there and the mentor sitting there, and you explain them this is wrong contouring, how can you say that's very difficult? But I did say this. Now we can solve it. We can solve this. If you have a very good auto contouring or inter-observer variability, and all those can be taken care by that. So we need to work on that direction. And thanks to IEA, they're working on that and involve me into this as a project. But what I'm saying to you that, this, we need to bring it. We need to bring it to our people. We can have our own guideline, our own contouring guidelines, practice guidelines, according to our requirement and the resources available. So IEA project is based on CT scan only. Not everyone have MRI. So then also we need to advocate, it cannot happen, you individually, you cannot provide. A country need government investment. We need to advocate for our field. Now everybody know radiation is part of 50% of the cancer treatment. So we need to advocate more investment, more training. That can be at a bigger level. When country invests will be bigger. So we need to make our networking and make that network to represent at the government level to advocate for our field. Because there are people I know, they are different field and they are advocating for us. It would not be the same. It's different. We have to come up. We have discussed this concept very recently, that AMSTRO catalyst, and I was inspired by the Global Health Catalyst. I saw some young guys. I attended Global Health Summit in Boston. Was really so impressive. I think what I was most impressed with the talk, in presence of humongous professors from Harvard and everywhere, was a child from the school. And I know his father's name, Will. I don't know his son name, I don't remember now. But his presentation was outstanding. I see him, he's going to be a big global leader in future. But when it is started, so that is what we want to bring it with the Global Health Catalyst collaboration. I talked to them, they're agreeing. We will create the catalyst and collaborate with them. That child can actually, honestly, teach me some leadership. So I want to talk to him because, this is the way we're going to move forward. Then I was talking to you about a region. Well, we need to have a global connection. This global village now, the whole world is a global village. I put some of the societies, logos. I was in rush actually, lack of sleep, so I just put few. I didn't have time to put more, but there are more collaboration we're reaching out to. We're reaching out to ASTRO, we're talking to them. We reached out to FARO, we're talking to them. We have ASRO and AORA endorsement. We have Oncology Club. I talked to Dr. Kamal, and I think we have the endorsement. We have, so I get the hand raised. I think Prof. Avery and Saiful Haq is here, so we have the Global Health Catalyst endorsement. We have PSCO, Pakistan Society of Clinical Oncology endorsement. So Prof. Ejaz is here, and he is very good in collaboration with that, and is collaborating in many global studies. So with all this, I think we have that. And with this, I will show you some pictures of some of our board members. I'm intentionally missing one board member here. That board member would know that his picture is not here. So you see myself, then Dr. Thuraiya Al-Hajri, proudly I can say she is present here. Very good supporter from Oman. We're all from different countries in our region. So myself, I can count it in Bangladesh, Pakistan, Ireland, and Canada. I can be counted in 4 countries. Dr. Layth Mullah Hussain from Iraq, he trained in Jordan. Dr. Jamal Khadr would know him. And then he went to Canada, and so he can count from Dr. Thuraya. I only keep the Oman to her, but the lead in the Oman, the highest Oman, and she trained in Canada. Dr. Abdul Al-Ghamdi is Saudi national, and he's Saudi Arabia. He trained in Canada and US. Dr. Isa Muhammad, Dr. Jamal working, he's the junior, and Dr. Jamal is the mentor and supervisor of him. So he's his student. Dr. Hussain Al-Kushi, longtime friend, Saudi national. He lead the National Guard in Jeddah, Saudi Arabia. He's the president of the society. Only one member intentionally missed because so many people talk about him. So I think I should skip. So what Bangladesh can do? This is a newborn society. We started walking. We will run. I'm sure we will run. But I think Bangladesh, not to be behind or back supporter, should come front and contribute and being the leader. And because shortage of time now, that person is coming here. And you know why I'm very proud of that. We will do good. How confidently I say to you, we will do good, because Prof. Saiful Haq is guiding and mentoring and helping us. He is already from Bangladesh. You see him, what his achievement, I cannot say just 2 I listed here, but there are many. He got US Presidential Award as well. So with this, I would be coming close to that. I think we'll be successful. But this meeting I want to mention to you, even my time is over, but I will ask you to take a minute to look into it. We're doing this meeting between 6 to 8 February in Dubai. It's called AMSTRO 2026 Global Oncology Conference. This will be a leading meeting in the region. I guarantee you the top leaders of IAEA, ASTRO, AAPM, WHO, UICC, you name, and many society. I cannot list them, committed, and they're coming. This is a very good opportunity for our people to come and interact with them, especially for those junior leaders, because this is the chance we can get together in 3 days to get from each other something. This is just before the Arab Health in Dubai, 3 days before. So people who are going to Arab Health, they can come just 3 days before and attend this meeting. And it's very simple to come to this meeting, free registration. And I would ask you guys all to do the free registration membership. If you have phone now, you can do it now. You just open, fill few information, short, and you can do that. And with this, these are our conclusion. I think we already talked about all these points. So if you go to www.amstro.org, you can do it in less than 5 minutes now. Please take membership. Please do registration. Free registration, free membership. And this is with then communicate. If you cannot come in person, which is the preference because you meet the leaders, you can attend virtually. There is no loss of you by doing that. So at least start with this one. So far we have 400 members, and we are expecting to grow in thousands for sure. With this, I will finish my talk, and sorry to take a minute extra.
Thank you, Dr.